Hi everybody, this is Ms. O'Brien. I'm just going to go over some Dentrix procedures that we use in our clinic, since you guys are going to be using these next semester, just to give you a little preview of what you're going to be doing once you start seeing patients in clinic. Okay, so logging into Dentrix, you want to look for the icon. It says Office Manager, and it's the little brown chair. Once you double click on that, a box will come up and you'll enter your user ID, password, and clinic ID. If you don't have these yet, Ms. DeSilvia will be getting those for you before the beginning of next semester. Okay, once you get into the software, this is the screen that will come up. The first thing you'll probably want to access is the appointment book, and it's the icon of a little book circled in red there. You double click on that and the appointment book comes up. This is what you'll see next. You'll all be assigned your own column in the appointment book. Ms. D will give you more information about that probably at the beginning of next semester. But once you're in there, you just need to double click on the time that you want to schedule the appointment. It's very easy to do. Okay, when you double click on the time where you want to schedule the appointment and the column where you want to schedule it, you'll see this box and it'll ask you if you want to make an appointment for a new patient, which you could click on the new patient button circled at the bottom, or if you're seeing an existing patient in the clinic, you can just search for them by their last name or first name, and you would do that up in the upper box circled there. Okay, if you're doing a new patient, you'll need to enter their information. This box will pop up and you'll just put in their last name and their first name. You don't need to do all the address and everything. You can just do the name and then click OK. And this is what will come up next. But you do need to, when you enter the patient in the appointment book, you still need to make a family file for them. So you would go up to the icon circle that's a little folder with 2 people on it, and you click on that to create a new family file. And this is what will give the patient a chart in Dentrix. Now when you click on the family file, you'll see the screen on the left. It'll be blank. And then you just click on File, as you can see on the right, and you can either click on New Patient with Appointment or New Family. I usually choose New Family. And you'll choose Create New Family and click OK, and then you'll see the screen on the right, and you'll fill in the patient information, their name, address, phone number, all that. I've circled one important spot, the provider. You'll want to make sure that you're listed as their provider, because we are tracking different procedures and things through Dentrix, so you want to get credit for the work that you do, so always make sure that you are the provider for the patient. Okay, and again, you might need to change the provider in this spot as well. That's when you're making an appointment. Okay, you can also change the provider inside the chart. Once you're in the chart, you just click on File, and then the drop-down box will come down, and then you click on Change Provider, and that'll allow you to change it as well. So there's several places where you can change the provider in Dentrix. Okay, when you're making an appointment, there's a lot of different procedures that you can put down there. We keep it pretty basic since so many people have access to the appointment book. HIPAA is a concern. So after you click on the patient, this box will come up and you click on Initial. You'll want to choose either Hygiene New, Reevaluate, or Hygiene Recare, or Hygiene Continuing Appointment. If it's a new patient, choose Hygiene New. If it's the new patient but it's the second or later appointment in their recare, you'll click Continuing Appointment. If it's a reevaluation, the 4 to 6 week perio reeval, you'll click on that, or Hygiene Recare as a patient of record in the clinic. Okay, and this is what it would look like if you clicked on Hygiene Recare. And then this is what the appointment book would look like. It just says the patient is Dentrix test, and it's a recare with the student is Amanda Morris providing the service. Okay, if you wanted to delete an appointment, which happens quite frequently, unfortunately, you would just right-click on the appointment box, and then you could go on the drop-down box and click on Delete Appointment, and that'll get rid of it. Okay. Also, when a patient comes in, you can go to the appointment book. You'll do this as a clinic assistant, and you'll just click on the box for the patient and then go up to the top and click Status, and you can click on Ready for Operatory or Patient Has Arrived. You would click on Patient Has Arrived if they've just gotten there, but they still need to go upstairs and pay. That will turn the left column yellow, and then once they're ready for the operatory, that will turn the left column green. That way you don't have to hang around the front desk waiting for your patient. Okay, and this just shows us that the new patient, Donald Duck, is ready for the operatory, so you would be able to see that on your computer in the unit that you work in clinic, and then you'd be able to go up and get the patient without ever having to hang around the front desk. Okay, once your patient gets there, you want to access their chart, so you just go up to the icon circled up there on the left, the tooth, and that's the patient's chart. Okay, when the patient first gets there, you're going to want to fill out their medical history. There's a medical history template on the desktop and also PDoc Signer. I'll explain that more in the coming slides. So the medical history is just a fillable PDF, which you will save on the desktop and delete once it's been imported into Dentrix. Okay, so when you click on the icon for medical history, this is what comes up. It's actually several pages long. It's the MetLife medical history. So there's blue boxes, patient name, birth date, and everything. You just type in your information there. And then there's yes and no check boxes for several questions, and you just check yes or no. If you do check yes, we want you to highlight those. Okay, so this is an example. You can see that the patient has checked yes for high blood pressure and diabetes, so we want you to highlight that in yellow on the chart. And then once you are finished filling this out for the patient, you would go to File, Save As, and then you would save it as Medical History Patient Name to the desktop. And that way you still have the blank template, and then you have the patient's chart as well, or the patient's medical history as well. Okay, now with the medical history, the last question on there, number 90, it wants a yes, an explanation for any yes responses. So for example, with the patient that we had, that we showed earlier that checked yes for high blood pressure and yes for diabetes, you want to put down the item number. High blood pressure was number 34. And then you put down the condition, and is it controlled, uncontrolled, just give some description and maybe what medication they're taking for it, anything pertinent. Number 62 on the medical history asks about drugs or medications. Again, you want to highlight it in yellow so it draws the eye to any yes responses. And then just write down the medication, what it's taken for, the dosage, and the frequency if the patient knows it. Okay, so once you have saved the medical history on the desktop, you will open up the PDoc Signer, and this is how we're able to sign the medical history. This is done once the instructor comes over and has reviewed the medical history, and then they plug in the ePad. It's our electronic signature pad. Then we open it in the PDoc Signer. So you double-click on the PDoc Signer, you go to File and Open. It'll give you a list of files that you can open, and you choose your patient's medical history. And then once it's open, you would click on the little pen icon circled up there on the left, and that'll bring up a signature box. We can see that Donald Duck is signed on the right-hand side, and then it'll put a signature at the bottom of the medical history. So that's done by the instructor, the student, and the patient. And then once that's completed, you would save that again, and it'll be saved on the desktop with the signatures. Okay, once you're finished with that, getting all the signatures and saving the medical history, you're going to import the medical history into Dentrix from the desktop. So you would go to the icon that looks like a filing cabinet, and that will bring up the Document Center. You can see up at the top of the screen captured, it says Dentrix Document Center, and the icon next to that, that's the filing cabinet that we look for. So, so once you're in the Dentrix Document Center, you would go to this icon that's circled in red, and that's the icon for Import Documents. You click on there, and you would choose the medical history from the desktop, and then you would list that as patient information and fill in medical history as the description. Okay, and then once it's been imported to Dentrix, Dentrix will want it signed once again by the patient. You can see by this little red circle with a line through it on there that it has not been signed yet. You would right-click on there, and it would bring up Sign the Document box, and then the patient would sign it again. Okay, other forms that need to be signed. There's several forms that we sign in clinic. There's a HIPAA form, there's Patient Bill of Rights, there's authorization for treatment, all kinds of different forms. Those can be accessed by going to the treatment planner, so that's circled in red. It's that little white chair at the top. And then once you're in treatment planner, you can click on the other icon that's circled. It's the paper with the red line through it. If you click on there, that's going to bring up all the forms for clinic. Okay, and you can see on the screen grab here that all the forms are listed. You just click on that drop-down box there. So we've got anything that we use in the dental hygiene clinic is going to say dental hygiene dash something, dental hygiene dash bill of rights, dental hygiene dash local anesthesia consent. Because we're not the only ones using Dentrix, the restorative clinic uses them as well. So you would just choose your form. Here we've chosen the dental hygiene bill of rights form, and then you click on add, and that'll bring up your form. Okay, and there we see it's a dental hygiene bill of rights. And here it is. So what would happen now is the patient would sign on the left-hand side, and then the practice signature, that would always be the instructor that's signing that, and they would sign on the right-hand side. So you want to make your clients familiar with the forms before the instructor comes over, just to expedite the process. Okay, after all the forms are signed and you've checked the patient's medical history, if they have any conditions, allergies, or medications, you're going to do a medical alert. The medical alert is that it's a white cross there circled in the red circle. That turns red once you do a medical alert. So you just click on that, and then the box on the left here comes up. And for a new alert, you would do the red cross with the yellow sun on top of it. And then you would just choose whether it's a medical alert, problem, condition, medication, or an allergy. You click on that, and then a drop-down box will appear, and you just choose whichever one. So this is just basically a mini medical history. It's just alerting instructors or the doctor to any medical issues that the patient has. There's also another one called Patient Alert. This is the little man with the flag. You just click on there, and then this box comes up. We usually use this for things like pending medical consults. You can put, like this one says hip replacement, you can put that on there. It's usually something that you really want to draw the doctor's attention to or the instructor's attention to, because this will pop up every time you bring up the patient chart. Okay. After doing your medical history and having it imported and all your forms and everything, you're going to review the clinical notes. So this is something that would be done before the instructor comes over. This would include your vital signs and things like that. Okay, so how you would do that is, let me just go back here for a second. This is the clinical notes icon circled in red. You just click on that, and that's going to bring up this next screen. And this has templates for everything that you're going to be doing in clinic, the medical history, the EOIO, the caries risk assessment. It's all listed on the right-hand side there. So the first one you're going to do is the medical history. And when you click on there, you're going to see all these kind of fill-in-the-blank templates. It's going to ask if they've had any changes since last visit. You're going to classify their ASA. You're going to put in their blood pressure readings, their pulse, their respiration. You're going to list their, if they need a medical consult, why, their chief complaint, all those things. So it's pretty easy. You just fill in something in each box. Okay, and then once you click OK, it's going to be on the part of the clinical notes then. Then you want to do your date time stamp. You guys don't have access to or permissions to sign documents in Dentrix because you're not licensed professionals. So this date time stamp is sort of like your signature. And you can see circled at the top, the icon, that's the date time stamp. So you'll do that at various times during the charting. Basically, any time a signature is needed by you, you'll just do the date time stamp. Okay, and then the instructor comes over and they do an instructor approval template that just says that they've reviewed the medical history. They'll put in the date that the patient paid and the receipt number if it's the patient's first visit. And then at that time, the instructor will sign it. And then once the clinical note is signed, you can't add to it. It puts a little asterisk next to the page number. You can see up there on the left. And the note is pretty much locked after that. You can do an addendum at that point, but you can't add any notes to it. And the addendum would be up here on the upper left. Say you forgot to write in the receipt number, or they were an ASA 2, not a 1. You could click on the addendum and type that in. And again, that's something that students don't have permissions for, but instructors do. So an instructor would have to do that. Okay, and this is just another template. I won't go through all of them because they're like really self-explanatory. This is the extra oral examination. So once you finish the medical history review, you just click on the extra oral examination and this template will pop up and you'll just fill it in just like you would with a paper form. Okay, and then once you press OK, this is what it looks like. It just has all the information that you put in. Okay, so what you would do after the medical history, and your instructor allows you to go on, you do the extra-oral, intra-oral examinations and Carey's risk assessment. Carey's risk assessment is done at the first appointment of the recare only, so that's just a one-time thing. Everything's done as templates, and it's very, very easy to do. You just follow along, and then the instructor will come over after that for a check. Okay, radiographs, there's a template for radiographs, and you would just fill out what type of radiographs you wanted, why you wanted them, when were the most recent radiographs, and then once this is filled out, you would sign up on the doctor's sheet for them to approve them. So the doctor will actually approve them remotely. She can bring them up on her computer, and once you see, you can see at the bottom it says these were signed by me, but in clinic they would be signed by one of the doctors, and once you see that signature, that means you're approved to go get the radiographs taken. Okay, periodontal assessment. You would start with this icon circled in red. It looks like a periodontal probe, and then it would bring up this perio chart. This one I just have filled out with the numbers in it. But once you bring up the perio chart, you can just start recording probing depths. And the probing depths will be recorded. It'll go 1 through 16 buccal and then 16 through 1 lingual. Kind of follows that pattern. So you just type in the probing depths, and you can see over here on the right-hand side, it's got the probing depths, the gingival margin, clinical attachment level. You can put all those in there. You can also record mobilities up here. Furcation grade is there. So for furcation, for instance, you would just click on the tooth where you wanted the furcation and put in the furcation grade. And when you click on the furcation, it'll ask you what grade for both the buccal and the lingual. If it's the mandibular, it might ask for 2 readings or 3 readings altogether on the maxillary teeth. Okay, once you're finished the periodontal assessment, you click on File and then just do Save Exam. It's always a good idea to save the exam periodically. If you're closing out, it'll ask you automatically if you want to save the exam, so that's a good feature. Keeps you from losing work. Okay, after you do the periodontal charting, you'll need to do the periodontal assessment template, and again, that's listed on the right-hand side under dental hygiene appointment. All the templates for our use are under dental hygiene appointment. Okay, and then here's the template. You just type in all the information, the color, the contour, the embrasure spaces, then you classify the patient. You know, are they a difficulty 1, 2, 3, 4, perio 1, 2, 3, 4. What's their prognosis, their different consultations that are recommended, so you just fill all that in step by step. And then once you click OK, everything will come up on the screen as part of your clinical notes. You'll date timestamp it, like I showed you before, and then the instructor will sign it once they check everything. Okay, with treatment planning, you're going to want to treatment plan several services. I have a Dentrix cheat sheet, which will be published on your Blackboard site. So this will tell you exactly what needs to be treatment planned. But basically, you're going to go to the patient chart, and you can see up on the right-hand side, circled in red, there's a lot of different categories. Our services are going to fall under different categories. Something like a comprehensive evaluation or the periodontal evaluation, that's going to be under diagnostic. Things like fluoride will be under preventative, scaling and root planing will be under periodontics. So you just go under the category, find your service, and then click on the TX button there at the lower part of that circle, and that means treatment plan. Okay, so here's we brought up one of the categories. I think this is periodontics, and then we click on the perio scaling and root planing. We click OK, and then we click the TX, and that'll put it in the treatment plan. And you can see the treatment plan services down below the tooth chart here. You can see on the right-hand side, I've got treatment plan, existing, and conditions all checked. So that I can see all three things in that itemized list there. You could uncheck existing and conditions if you just want to see the treatment planned items, or uncheck treatment plan and check existing if you just want to see existing conditions. Okay, here again, this is the preventative category, so topical fluoride varnish D1206 with CDT code. You just click on there, hit OK, and then hit TX, and that will put it in the treatment plan. And then this is just another scaling and root planing treatment plan that's under the periodontics categories. Okay, so once you get all your services in that you're interested in, you would bring up the treatment planner, and that is the same place where we went for the forms. That's where we're going to go for the treatment plan. So it's a little white chair. It turns green if there's services in there. So it's right next to that periodontal probe that we used for the perio charting. Okay, once you have your services in there, you're going to click on the green chair, and that's going to bring up this front screen, the treatment planner. You'll have a whole bunch of services listed. What you'll need to do is number those. So you're going to do this with your instructor when they come over for the perio assessment. All you do is right-click on them and move them to the order that you want. So, for instance, your comprehensive oral evaluation, that'll be in visit 1. Your radiographs will probably be visit 1. Your comprehensive perio evaluation, visit 1. Then maybe visit 2 is your OHI. Then you actually start doing your scaling. So it just gives you an idea of what you're going to be doing at each visit with the patient. Okay, and this is what a finished treatment plan is going to look like. You can see we've got this patient down for 4 visits. They're perio 4, difficulty 4. That's probably realistic. So this just allows us to see our plan for how we're going to take care of this patient, and it also allows the patient to see how long we think it's going to take. And at that point, we would actually have the patient sign a treatment plan consent form. So what you would do is just from that treatment planner, you would just go to that piece of paper, which is the forms icon. You click on there, and from the drop-down box, you're going to pick the dental hygiene treatment plan. And the consent form will look something like this. It has some standard verbiage at the top, and then at the bottom it lists each service that you're going to provide and what visit number you're going to provide those at. So this will allow the patient to review how many visits it's going to take, what exactly you're going to do. Then the patient would sign the left-hand side, and the instructor would sign the right-hand side. Okay, and then you would do the treatment plan progress notes. You just click on the template for treatment plan instructor approval and just fill out that everything's been documented. Okay, the hard tissue exam, what you're going to do is document any restorations or conditions for each tooth in the mouth. You just go to the right-hand side and you would click either conditions or restorative, just anything that exists in the patient's mouth. Anything that's existing, you're going to document that is the EO, and that means existing other. That means it's been done but not in our clinic. So say tooth number 1 is missing, you would go to, you'd highlight tooth number 1, you would go to conditions over here on the right, and then you'd pick missing tooth, and then you would click on EO, and that would place it at the bottom in that list there, so as a missing tooth. Okay, and this gives you an idea of what, once you're finished the hard tissue exam, all these conditions have been put in. Person might have missing teeth, amalgam restorations, rotations, you know, all kinds of things. So you just go ahead and document each one. Here's for conditions, we've got, here's a rotation mesiobuccal, rotation mesiolingual. So you pick one of those and then click EO, and that will put it in their hard tissue chart. Okay, and we've got various shortcuts. There's up at the top, you've got amalgam restoration, composite restoration, sealant. You've got shortcut buttons for the radiographs there in the middle. So you can just get in there and you'll have some time to explore Dentrix in the next few weeks in clinic and take a look at those. This will all make a lot more sense then. So then once you're finished the hard tissue assessment, you're going to write it up in your clinical notes and just have the DDS sign off on it. You'll actually not be putting the conditions into the hard tissue chart until after the DDS has approved them. You'll do the hard tissue worksheet first, and because you guys don't have rights to delete things from the hard tissue chart, so we want to get everything corrected before you actually put it into the computer. Okay, once you're finished with the hard tissue and get that checked, your next step is going to be the OHI and plaque index. And again, this is the, there are templates on the right for this. So you click on the plaque index one, and that'll bring up a template. And it's not a graphic, so it's a little different in that respect, but you just put in which surfaces of the tooth has this closing solution on it, which means there's plaque there. Then you figure out there's 4 surfaces per tooth that we record, so you just find out your plaque index by doing the math. Okay, and then all the templates are listed on the right. We've got templates for everything, local anesthesia, periodontal debridement, recare, sealants, everything. So you guys can explore that with your time in clinic in the next few weeks. Okay, this is more for instructors than you guys, but at the completion of your recare, you're going to close out services, or the instructor rather is going to close out services, and that's just done by double-clicking on them on the tooth chart down at the bottom, and it'll bring up this box, and we'll click complete it, and then RVU is the grade that you get for the service. So that's not really something you guys need to worry about. And once you close out the services, again, this is something the instructors will be doing. They'll need to close out the treatment plan that you were working through. As all the services are closed, then you can just right-click on the treatment plan. Or I'm sorry, you click on the treatment plan and then click on this folder with the arrow, and then you choose complete it. Okay. One thing that you will need to do once you're finished the patient, you'll want to go into the continuing care in the family file. So you just bring up the family file for that patient, which is the folder with the 2 little guys. Then the family file will come up, and you click on continuing care. You'll click on the perio, edit, and then you'll click on the due date, and you'll change the interval. So the interval will default to 6 months. You'll probably want to change it to 3 months or 4 months. Most of the patients that we see in clinic are pretty periodontally involved, so a lot of them are on 3 or 4 month recall. So just remember to change that. That way when we print our recare list, they'll come up as needing an appointment, and you'll be alerted to that. Okay, we've had some problems with the clinical notes. Basically, your one, you can see here on the left circled in red, it's note number 1 and then page 1, 2, 3, 4, 5. You want one note with several pages for each clinic. The next page shows you, this has got note number 1, page 1, note number 2, page 1, note number 3, page 1. That's what you don't want. In order to avoid doing that, you need to expand your pages and just make sure that you're not on the note. You have to be on a page, either page 1, page 2, page 3, page 4. When you click on another template, it'll bring up a new page. But if you're on the note, it will bring up a new note when you click on a template. That's a little bit of a confusing concept, I know, but it's something I can show you in clinic. It's kind of hard to convey that over a presentation like this. But you can make a new clinical note page just by being on a page and clicking on a new template, or you can go up to the top here, and this is the icon for making a new clinical note page. You really won't need to make a new clinical note unless the person's coming back for one appointment in the morning and one in the afternoon. You only need to make a new page usually. Okay, now this shows you the clinical note. If you see circled in the red, kind of on the right here, it says note number 1, and it's got those dashes along the top. That means you're on a clinical note, not a clinical note page. So if you were on this page and you clicked on a template, it would open up a clinical note, and that's what we want to avoid. So make sure that you don't see these dashes, that you're on a page and not a note. And it's usually better to, when you're dealing with with a patient's chart, click on this little icon for expand all, and that will just expand all the notes and the pages. I find that when people have those collapsed, they wind up on the note, and then they click on a template, and it opens a new note. So we want to avoid that. And I know this is very, very confusing in this format, but we will show you. You'll be working with the instructors in clinic, and it'll be a lot more clear when we show you in person. Okay, that's about it. So hopefully this helps you a little bit. This PowerPoint with notes will be available in your Blackboard site for 141. You can watch this presentation as many times as you'd like or not like. And then there's going to be a Dentrix cheat sheet, and I have a Dentrix exercise that you guys can do in clinic. So between all those things and the instructor's help, you should be able to get it. I know a lot of you have worked in dentistry and probably have worked with Dentrix before. It's a very, very popular program. So it's kind of nice that we're preparing you guys for when you graduate to be pretty much experts on this. So if you have any questions, I'm in the office with Ms. DeSilvio. I can always help you out, or one of the other instructors. Everybody knows it pretty well now. So thank you for listening, and I'll see you guys in clinic.